What I feel is nurses are the only healthcare professions who work closely with the patient 24/7, unlike the other healthcare professionals. So I think that is what made nursing a little unique for me, because we can provide direct care to the patient.
Nursing, as I mentioned earlier, is one field which combines medical knowledge with compassionate care and focuses on the holistic well-being of the patients. So the reason why I chose nursing was that. And what makes it different in DSU is that the teachers are way more approachable and helpful, I feel. As I've spoken to other friends who are in different universities, the teachers are way more helpful. And then the first and the most important thing I feel is we have our own parent hospital, which gives us way much more exposure to patients, as we can go to the hospitals anytime. We've given night postings, we've given day postings, we've been posted in ICUs, we have been posted in different places. So it makes it very easy for us to learn about different cases that our other university people struggle because they have not exposed to such patients. So that's a very big advantage of joining DSU.
We have many seminars in which professors or even international personals, they come and they talk to us, be it in person or in a Zoom video chat and all. We also collaborate with other hospitals or any societies like Spastic Society for the mentally challenged children and all. So there is always collaboration, be it with inter-department or be it with the outside universities or other departments.
Which gives us a good skill to how to talk, how to be socially more accepted, and makes us overall prepared for the world outside after our degree.